Welcome back, 841. Women who have had surgery to treat breast cancer often go through breast reconstruction. And this morning we've got Dr. Erez Dayan, a surgeon at Advanced Plastic Surgery, to tell us about the different reconstruction options that women do have. And you work with this a lot in your field. How prevalent is breast cancer in the women that you see?
It's extremely prevalent. Nationwide, it's about 1 in 8 women. That's 12%. That's the #1 cancer in women nationwide, and it actually affects women in developed countries more than in less developed countries. So it's a significant problem in our communities.
And we know, a lot of that, women have to end up with mastectomies and everything. What are kind of the options for reconstruction that women do have lying ahead of them?
So luckily, with advanced techniques and technologies, we really have an array of reconstructive options, and they continue to progress and advance. What's interesting is where I trained in Boston in a major academic center, the Harvard program, we did the full gamut of breast reconstruction, and I think it's very important for women to know what their options are, because as people are different, their reconstructive options may differ, and what they prefer may be different too. So for example, very commonly performed is an implant-based reconstruction.
Right.
And that can typically be done in 1 stage or 2 stage. Sometimes we expand the skin and then exchange it for an implant. Sometimes we just put an implant in. But there are more advanced techniques, for example, taking tissue from the abdomen and transferring it to the breast using microsurgical techniques. We can connect the blood vessels and basically, simplistically, kind of do a tummy tuck, take that tissue and
I'm sure they don't get mad about that.
and repurpose it for the breast. And it gives you a natural shape with your own tissue.
Wow. And in addition to all the reconstruction, you're also doing some genetic testing to help with all of this. So how does that work?
Yeah, so when I was in Boston, we just published a paper about a month ago talking about genetic testing. So about 5 to 10% of breast cancers have some kind of genetic correlation. And the most popular genes are the BRCA1, BRCA2 gene. It became very popularized with Angelina Jolie and prophylactic mastectomies. And what our research showed essentially was if someone has a breast cancer and they're going to go the reconstruction, the more kind of involved reconstruction of taking your own tissue, it's worth testing them for the genetic mutation, because if they have it, they may want to also do a prophylactic on the other side and save the potential issue of going back and forth twice.
So if people have questions about this or they want to learn more, you do have a grand opening coming up.
Yes, we're very excited. We're very excited to be in Reno and serving this community. Our grand opening is on September 5th at 5:30 p.m. For details, you could look at our website, advancedplasticsurgery.com. AVANCE, and we welcome everybody in the community.
Yeah, definitely something to check out, as this will probably affect, if not you, someone you know. So some great information to have under your belt there. Let's check in now with meteorologist Steve Bender for a look at what our forecast is going to look like.
Weather Authority forecast brought to you by